Defining a sprain. A sprain refers to an injury to a ligament, which is the tissue that connects bones to each other. It usually occurs when a joint is twisted or stretched beyond its normal range of motion, causing damage to the ligament. Sprains commonly happen in the ankle, wrist, or knee. Defining a strain. A strain involves an injury to a muscle or tendon, the tissue that connects muscles to bones. It typically results from overstretching or tearing of the muscle fibers. Strains are common in the back, hamstrings, and shoulders, and they can happen during physical activities that involve heavy lifting or sudden movements. Causes of a sprain. Sprains are generally caused by a sudden twist, fall, or impact that forces the joint out of its normal position. Activities like sports, walking on uneven surfaces, or accidents can lead to sprains, especially when the ligaments are stretched too far. Causes of a strain. Strains occur when muscles or tendons are stretched too far, often during high-intensity physical activities or overuse. Lifting heavy objects, jumping, or sudden movements can strain muscles, leading to tears in muscle fibers, which can vary in severity. Symptoms of a sprain. The symptoms of a sprain often include swelling, bruising, pain, and limited range of motion in the affected joint. In more severe cases, the joint may feel unstable or unable to support weight. Symptoms of a strain. Strains typically cause pain, muscle spasms, swelling, and sometimes bruising at the site of the injury. Individuals with strains may experience difficulty moving the affected muscle or tendon, and the area may be tender to touch. Treatment for a sprain. Sprains are treated by resting the injured joint, applying ice to reduce swelling, compressing with an elastic bandage, and elevating the injured area. In more severe cases, immobilization with a brace or splint, or physical therapy, may be required. Treatment for a strain. Strains are treated similarly, with rest, ice, compression, and elevation, RICE. Additionally, muscle strains often benefit from gentle stretching and strengthening exercises as they heal. Severe strains may require medical intervention and rehabilitation. Recovery time for a sprain. Recovery from a sprain varies depending on its severity. Mild sprains may heal in a few weeks, while moderate to severe sprains can take several months to fully recover, particularly if ligament repair is needed. Recovery time for a strain. Strain recovery also depends on its severity. Mild strains may improve within a few weeks, while moderate to severe strains may take longer and require physical therapy. Severe strains may involve tendon repair, which could extend recovery time.